Hello everybody, I am Dr. Amitabha Chanda. I am a senior consultant neurosurgeon at Rabindranath Tagore Hospitals and Narayana Health. Today I am going to talk about a potentially dreaded disease, that is brain tumor. Brain tumor untreated will invariably lead to serious disabilities or even death. So it needs to be taken very seriously. Brain tumors are abnormal growth of cells in the brain or in the brain covering or in the surrounding bony structures or the nerves arising from the brain. So any tumor arising from these areas, we call it brain tumor. Brain tumor can be benign or non-cancerous, or can be malignant or cancerous. Again, the malignant tumor of the brain can be classified into two. One is the primary brain cancer, which arises de novo from the brain, and secondary brain cancer is a cancer occurring elsewhere in the body, like lungs, breast, may spread to the brain. This is called secondary brain cancer. The major symptom of brain tumor is headache. 70% of the people will have headache due to brain tumor, but you have to remember that 30% of patients will not have any headache if they have a tumor. So it's not invariable that if someone has a brain tumor, there will be headache. Headache might not be there. The other symptoms which can happen, like are seizure, which are like convulsion, dimness of vision, double vision, numbness of face, weakness of one side of the face, diminished hearing, difficulty in swallowing, balance problem, weakness in the limbs like hand or legs, and urinary incontinence, and even hormonal problems can happen due to brain tumor. It's not that any of the symptoms means it's brain tumor, but one symptom or in combination with other symptoms gives rise to suspicion that this particular gentleman or lady might have brain tumor and should be investigated accordingly. It can happen in any age. It follows man from cradle to grave, we say. So no age is immune to any brain tumor can happen and occur in any age, from children to octogenarian, anybody. Once the symptoms appear, patient should be investigated. The gold standard investigation is contrast-enhanced MRI. In some cases, CT scan might be needed, but gold standard is MRI contrast. Other investigations might be needed, like MR spectroscopy, brain angiogram. Some investigations are needed to plan the surgery, like functional MRI, MR tractography, and so on. The treatment of brain tumor is mainly operative treatment. There are other treatments like radiation, chemotherapy, or some medication, but these medications, the chemotherapy, radiotherapy, are mainly adjuvant treatment rather than the primary treatment. Very exceptionally, radiation and some medication can be primary treatment, but by and large, operative treatment is the main treatment. As of today, there is enormous advancement in brain surgery. We can utilize a lot of modern technologies to make the operation very safe. And honestly speaking, if you get operated by an experienced, skilled surgeon in a good center, the result is good by default. Usually the results are good. Very exceptionally, the result can go in the wrong way, but given all the optimum situation, operated by a very good surgeon, very experienced surgeon in a good center with good gadgets, the results are good. There are some instances where primarily we go for radiation treatment, but again I repeat that main treatment is surgery, surgery, and surgery. The reason of why do we do surgery is to get a tissue diagnosis for the sample, whether it's a tumor is benign, malignant, or what kind of tumor, and to reduce the mass effect, the pressure effect in the brain. So these are the two reasons what we advise surgery very strongly to the patients. And again I am repeating that please do not delay, go to a good neurosurgeon, get yourself operated or treated by the neurosurgeon, and the results are invariably good. Thank you so much.